started. We are the 2016 recipient of the Governor Sterling Award, one of 50 FQHCs invited to participate in National Network of Oral Health Access, the only community health center in Florida to operate a HRSA-funded teaching health center. I want you to have an appreciation for these achievements, because you are not just another FQHC. You are exceptional. And you ought to understand these achievements and walk with pride whenever you speak about CHI or whenever you come to work. You should feel good about coming to work at an organization that has these multiple achievements that sets you apart from others. In 2018, you served over 83,000 unduplicated users of our healthcare system, totaling 289,000 patient visits. I want to thank you for all that you do, day in and day out, to serve our patients. And so, this morning, there are speakers who will follow me. So I will hold an opportunity for questions after we have completed all of the presentations. So, Mr. Hall.
Thank you, Colonel. How about a round of applause for Mr. Hartley, please? President and CEO. So today is one of my favorite general care team meetings because today is about you. And Mr. Hartley mentioned earlier that CHI is an exceptional health center. But before I get into my very brief presentation so that we can move forward, is everybody happy? That doesn't sound like you're happy. Is everybody happy? We just had Valentine's Day. I should see some smiles, right? A couple smiles, fake smiles. Just before I get started with my PowerPoint, can we bring that back up here? I want to say a very warm welcome to our family down in the Keys. Today is the first time we're actually live streaming. So they get video and audio down in Marathon, so it's excellent. So I'd also like to apologize briefly for the challenges we've had. Believe me when I tell you we've tested and tested and tested. Sometimes things happen. So, but thanks for hanging in there. So a couple things I want to share with you is a little bit about our strategic plan. We all know we have a strategic plan, right? Yes? I only heard one or two yeses. Lie to me, please, because we put it out there. Okay. So we all have a strategic plan. Well, CHI does, and we adopt it every year. And there are a couple things I want to tell you about this morning. Our service pillar. We have 5 pillars of excellence. Do we know those pillars? Service, quality, people, growth, and finance. So today I'm just going to talk a little bit about our service pillar, and then a couple of other things I want to mention to you up there. So looking at our strategic plan, one of the things that we track is courtesy and respect. So for the last couple years, we've been looking at courtesy and respect from the eyes of the care team and how the patients feel that they've been respected from the care team. Moving forward, we're going to look at it from all staff. So that includes myself, that includes our finance staff, our back office, our drivers, everyone at CHI. We were now tracking courtesy and respect. So the goal, we're actually posting our new strategic plan at all of the sites. So I'm not going to tell you the goal, but I'm going to encourage each one of you actually to go back to your center and look for the goal on courtesy and respect. And if you can't find it, ask your site supervisor. If your site supervisor can't bring it to you, I wouldn't take that as an answer, but I'll make sure to send it out a little bit later today. So the one thing I want you to remember about courtesy and respect is that patient care does come first. Treat people how you wanted to be treated. Remember the golden rule, right? Sound familiar? Can I get a couple nods? Are we asleep? Get enough coffee? Okay. The golden rule. And then also, 8 it. So acknowledge, introduce, duration, explain, and thank you. We all remember that. I see some heads nodding. And then also the 10-5 rule. If you remember, everyone remembers the 10-5 rule? Show of hands. I see most of us. Okay, excellent. So please practice the 10-5 rule. And I remember, we've talked about this several times in the past, and I understand that everybody doesn't have a perfect day sometimes, but try to be genuine, because people can tell if you're genuine or not. So the next part of the service pillar is phone experience, and I have some exciting information to share with you today. We're tracking the percentage of patients satisfied with phone experience. We all know that phone experience at CHI has been a challenge over the last couple of years, right? Yeah. Right? I see several heads nodding. Okay, so the goal, again, I am not going to tell you the goal here. I want you to go back to your centers and look for where our strategic plan documents are placed. Ask your site manager if they don't if you can't find it. And then later on this week, I'll make sure to post it so that everybody sees it. But some actions that I want to tell you about, some of the changes that we've done over the last month or so with regards to our phone experience. So we've had multiple improvements. We actually completed and we have several improvements that we've completed and are ongoing. We've done an infrastructure overhaul, so there's new technology behind our phone system now. We've worked with our referrals department to make some changes in implementation. We're now working on our main extension, the 5100 number. A couple other things. We have, and I'd like to thank our volunteers. Our volunteer program every day in the morning calls each and every site to check to make sure that the phones are ringing, that someone is answering the phones. And then when it's not, we're actually reporting it. So thank you to the volunteers for that. The call system routing, our partnership with Call for Health. Everyone's heard of Call for Health, right? Okay, if you haven't, Call for Health is one of our vendors that we use to help work on appointments for us, to help make appointments. And our very own call center. I see, where's our call center staff? There are only a few of us. Anyone here? There's a couple in the back, yes. I want to thank the call center staff, and I'm going to tell you why right now. So you see here February 6th on the left and February 15th on the right, all right? So this is some data that we have, and we're actually working now to get better data and more data, but this is on February 6th, and if you can't see this, on the top left we have agents logged in. To the right, you have agents not ready. Underneath agents logged in, you have the number 3 underneath there. It says calls offered, 236. Calls handled, 188. Okay, underneath the 236, you see calls in queue, 1. The calls abandoned, 48. Underneath the number 1, you see longest wait in queue, 2 minutes and 13 seconds. So that's the longest wait for that one person in the queue. Longest wait today is 8 minutes and 35 seconds. That was on February 6th. This is on February 15th. 3 agents logged in, 0 agents not ready, 190 calls offered, 186 handled. There are 2 calls in the queue, only 4 calls were abandoned. 4. Did I say that? 4. Okay. Longest wait in queue, 24 seconds. Longest wait today, 3 minutes and 31 seconds. I look at this data every single day, multiple times a day. So when you look at February 6th, that was a 20% abandonment rate. February 15th, that's a 2% abandonment rate. So thank you to the call center. Great job. Just a little bit more about the phone experience, and I just got the flag that I need to speed this up. So if you have a challenge with your phone system, tell us. Tell us right when it happens so that we can help get on top of it. You can email chiPhoneissues@hcnetwork.org. You can tell our IT department. You can call me at extension 4853. And if you remember an issue but you didn't report it, you can call Dr. Moff at 2:30 in the morning on Sundays, and he'll answer your call. A little bit about the patient portal. Everyone knows we have a patient portal, right? Right? Okay. So we have, the measure is percentage of patients utilizing the portal. The goal, remember, find it at your center location. We want to increase the adoption rate of about 400 new patients a month through the end of 2019. We actually did make a recent improvement, but I want to encourage everyone. The website is myhealthrecord.com. We all know that, right? Right? I see a couple of nods. Okay, MyHealthRecord, I use it personally. It is very good. I was able to do several things. You can see all your health information, send secure messages, request prescription refills, and even make appointments. Wait time. We all know about wait time, right? So I'm not going to go too in-depth about it right now because we've really been focused on our phone system. But I do want to encourage everyone to go back to your center, find out the goals about wait time. But remember this, we want to encourage our patients, we want to reduce patient wait time and increase efficiencies so that patients can come through our system a little bit quicker. Next, Works Hub. Everyone has seen Works Hub, right? Yes? Has anyone used Works Hub? No. I see a couple hands. Do we like it? That didn't sound too convincing. Do we like it? Yeah. Okay, so let me tell you one win about Works Hub. If you haven't seen it, it's this little icon right down here. It looks like a little house. I actually went into the walk-in services department at Doris Sison last week and spoke to some of the staff, and they said the day after they put in their ticket in Works Hub, things got addressed. And so I want to encourage each and every one of you with regards to Works Hub to utilize it. It went live February 1st, and you can do work orders, set up events, internal supply requisitions, catering, etc. Last but not least, I want to talk about advocacy. I see I've got about 1 minute left. And when you look at community health centers throughout the state of Florida, we are one of almost 50. There are 49 health centers here, representing about 550 sites. We serve, in Florida, 1.4 million patients. 550,000 of them are children. That's represented by 5 million patient visits. 36% are uninsured. That's compared to 9% nationally. And when you look at Florida, 92% of community health center patients live at or below 200% of the federal poverty level. That's significant. Last but not least, I do want to mention 10,475 total staff. That's physicians, nurses, dentists, support staff, etc. So when we ask you to participate in advocacy, there's a purpose for that. It's because we want to be able to see more patients. It's because we want to make sure that everyone continues to stay gainfully employed. And so please, in the very near future, you'll hear a little bit more information about us, asking you to reach out to your elected officials, to Congress, to send an email or make a phone call, and we'll provide you with all of the information so that you can do that. And please, I ask again for your commitment to participate in advocacy. So that being said, today is all about you. You can see all of the great awards that we have here lined up. And I would like to bring up Dr. Mofa for the next presentation. Thank you, everybody.
Good morning. You know, you can't say good morning nicer to Blake than you did to me, right? Good morning. Thank you so much. So I thought I had 30 minutes, and then I found out last night I have 10 minutes. And then I found out a few minutes ago that I got an extra 5 minutes from some of you. So thank you guys for giving me extra 5 minutes. I always need a lot of time. So I'm going to set my phone here so I am on time. I have so much to talk about. But I'll keep it short and sweet. Okay, so those of you who work with me have heard me talk about the bell curve many times. This is like an inverted bell, right? And this bell curve helps us understand, not necessarily explain, but to understand many different human attributes: behavior, performance, how hard we work, how well we listen, how respectful we are, right? Everything gets understood by the bell curve. And I think it's something that I like to share quite a bit for many different reasons. So in any group of people, 600, 700 people here, there'll be 20% for a particular attribute, 20% high performance, and about 60% will be average, and another 20% will be low performers for some particular value we're talking about, right? That same bell curve gets to explain basketball in terms of people's performance. And so in any basketball game, a group of people playing 20, 30, 40, there will be about 20% who are high performers. You know, they're just fast, they don't sit down to rest, they dunk, they score lots of points, and like Maurice, right? I think you'd agree, maybe Jonathan, Amofa, for example, right? Anyway, these are my slides. I get to put whatever name I want on there, okay? That's the way it works. And they're going to be the average performers. You know, these folks, they're okay. They're sitting down half the time. They just score 1 or 2 points the whole season. And, you know, I don't want to be offensive, so I'm going to use initials for those. JP, JR, you know yourselves. You know, it's like, then they're the low performers. I mean, these guys actually think they're playing soccer, actually. It's like, they're just terrible. And, you know, again, just initials, you know, they know who they are, AH and, you know, BH. AH, BH. But look, we all know who we're talking about, okay? Don't just joke around here. We're talking about, like, come on, you know. So this same bell curve gets to help us understand respectful communication in any group of people. 700 staff, unfortunately, they're going to be about 140 of us who are low performers. What does that mean? These are the people who is yelling at other staff. You know, the staff person puts a patient on the schedule and they get upset and then they talk down on them. These are folks who, you know, they talk to a patient as if they own this patient. This poor patient who's coming all the way from home sick and tired, and we speak to them as if they are nobody, you know. Those are the low performers, but I have no doubt there's nobody in this group here. Maybe those low performers are somewhere else. They're off for the day or something, right? None of us would. Statistically, this doesn't work with respectful communication. Is that what we're saying? Because statistically, there's supposed to be 140 of us who fall in this group. Is that okay? And then they're going to be the high performers. You know, those of you who really get it, who understand that people are different. You recognize that every opinion counts. You're able to express and receive feedback and not make it personal. You know, you practice authentic listening, but very importantly, you treat folks as you want to be treated. I talk about this because over the past few weeks, I've had quite a few complaints that just break my heart about how we've spoken to each other, and that's not okay. But I'm walking away from here confident that perhaps it was that FQHC down the street that people were talking about, not us, that all of us appreciate that while we still have the bell curve that helps us understand the variation, all of us actually are in the high performance group. So let me just take a picture of that. Can you raise your hand if you believe that you're in the low performing group? I just want to, if you don't mind. Low performance, respectful communication, I knew it, nobody in there. What about the middle ground, average, you okay? Anyone, just raise your hand. I knew it, Colonel. So everybody's high performer when it comes to communication, and we thank you so much for being so nice and kind to each other, and understand that, you know, when people have a family, they have a life, they have a heart that's kind of beating, and they have blood in the veins just like all of us. And do we have any right to really speak to people disrespectfully? We don't. But I'm very confident that that's not the case here, so we'll let that pass. What I will tell you is that as a leadership team, we know that we set the tone for that communication that exists. And I'm just going to mention a couple of things from this slide. You have my commitment and you have our commitment that we'll do some things to help to make life easier for you, to do what you do best. In building good support teams, we know it helps you be respectful in your communication. Huddles, staff meetings will support that, will encourage that. We will certainly optimize workload because we know sometimes that tension creates disrespectful communication. And we're going to continue to do these kinds of things. I'm going to skip because I want to go on to a few other things. We'll certainly will acknowledge your good work. and award you when you do great work, which means we then have leverage if you are not being respectful in your communication to let you know that and hold you accountable as well. But we want to commit to you that we will do our part, but you have to do your part as well. All right, so I'm going to go over Joint Commission Must Knows. This is really what I want to go over, and I'm going to go through and end wherever my time ends. And we'll send these slides out. They're very simple questions and answers. Joint Commission survey coming up any day now. We're in the window. We expect to be in April. There'll be 3 surveyors for 4 days. 3 surveyors for 4 days. That's a lot. They're going to be under your nose, in your mouth, in your whatever. They're going to look in every drawer, look in every corner. This is intense, you know. And so bell curve explains what's going to happen over the next few minutes in terms of people who are going to, how well you're going to listen to me. They're going to be the low performers who will certainly have their phone up, social media, texting. You know, who are going to think, who cares? I probably won't be here when they show up. I'll take the day off. So raise your hand if you think you're going to be in one of those groups for the next few minutes as I speak. Then there are going to be those of you who are going to be very engaged and you'll be listening. You won't even tolerate any sidebars. You will certainly own the content of what I'm going to talk about, and your mindset will be, I am CHI, and I'm going to listen. I have no doubt all of you fall in that group. So what do we need to know? Let's know that the number of findings per survey went up the last couple of years before last year to about 18 per survey. 3 surveys for 4 days. We are at risk of having a lot, but it is our goal to do way better than that. So what should you do when the surveyors arrive? Now, we do believe they'll all arrive in Doris-Eisen, but they may, actually sometimes 1 or 2 of them may show up at another site. In principle, make sure you ask for their ID badges. Sorry about that. You take them to information desk. They need to get a visitor's pass, take them to the boardroom, and then there's a call tree system that's initiated, and there'll be email blasts so everybody knows that they're in the house, okay? I just mentioned this for those in satellite sites. If one of them shows up, remember, check their ID badge and call your supervisor, okay? Because sometimes people are imposters. We don't want to see that. You need to know these folks. Who's your HIPAA privacy officer? Everybody knows that one. You know, who's a HIPAA security officer? That's different. That is usually IT. And HCN's IT department supports the security function as well. We know Maurice is the chief security officer. A patient safety officer, also known as a risk manager, is one, okay? Facility safety is Ken, and infection control practitioner, everybody must know by now, is Patricia Philippe, okay? You might get asked this question, and you cannot not know that. All right, what else should we know? Patients' rights and responsibilities. How do we advise patients of these things? Everybody knows that during registration. It's posted on the website. And in your sites, if you're in a site and the rights and responsibilities aren't posted, please make sure they are, okay? What is our policy on advanced directives? Please remember, we do not honor, do not resuscitate orders in CHI. If somebody passes out codes, we're going to call 911, even if we know they have a do not resuscitate order. That is our policy, and we make sure we let patients know that. Okay. Abuse, neglect, you will get asked usually at the front desk level. How do you look out for abuse, neglect? Everybody knows that, okay? And what we advise you to do is, once you suspect abuse or neglect in a patient, let a provider know, let your supervisor know, and they know what to do. I'm going to skip that. What do you do if a patient collapses in the waiting area? Hopefully you all know you're going to run to the patient, find out if they're responsive, call for help, okay? Yell if it's a small site. Have somebody call code blue and initiate CPR as needed. Hopefully everybody knows that. We know these are the emergency codes, right? Code blue, code yellow, code red, missing fire, code pink, missing child, and so on. And hopefully, if you forgot about these, just memorize that. When you get the slides, make sure you look at that. All right, so at this point, I'm wondering if there are any low performers in listening. Anybody on their phone who's tuned me out already? Anybody falling asleep? Not yet, good. Okay, I'm gonna skip this one, come back to that later. But I know there are lots of care team members here, and this issue comes up a lot, so forgive me those who are not care team members. This is my chance to remind us that we have look-alike, sound-alike medications, insulin products, Humulin, Humalog, metformin, metronidazole, Zantac, Xanax, and these medications we can make mistakes from Just know we have them. If you don't have it posted in your site, please ask for it. We just updated them recently. And what do we do to eliminate or reduce errors from those? Lookalikes, analytes get a red dot. So if you have insulins in your shop, make sure there's a red dot attached to those. And then there are high alert medications. Again, these are also posted out there. Examples are the insulins again, warfarin. These present a high risk for errors. And those ones, we use a yellow dot. Okay, red dot for lookalikes, analytes, a yellow dot for high alert medications. And again, we need all of your eyes on deck to make sure this is not a finding. It's always painful when staff gets asked the question, did you receive orientation when you started in CHI, and we forget the content of. But remember, orientation is at 3 levels. There's initial general orientation, that is an education department. Then there's the department-specific orientation. You know, hopefully your supervisor walks you around the unit, shows you where the fire extinguishers are and those kinds of things. And then there's a job-specific training orientation, okay? There are 3 of them. You need to remember that, and you need to say that when you're asked. Sometimes we forget that we do all of those things so creatively that we don't realize that. The topics that were discussed in orientation, there's a whole bunch of them. I see I have 2 minutes. But don't forget that we discussed the mission, vision, values. We discussed OSHA. We discussed HIPAA, infection control, the medical home. We discussed cultural diversity and domestic violence and abuse. Those are specific Joint Commission requirements, and sometimes we just blank out. Just remember that. Those were discussed, and hopefully you won't forget. So now I'm going to skip on to some things about the medical home to end this session. Have you heard of the medical home? It is so painful sometimes to see people just blank out. If you've been working in CHI for a few months, you must know that, like Mr. Halley said, we are a medical and behavioral health home. What does it mean? It is a medical home, a behavioral health home, is a place where a patient gets to see the same care team. The patient receives comprehensive care. We care coordinate the patient's care, and the team is empowered to fully participate. That's what it's all about. What changes have we made since we became a medical home? We have enhanced our rights and responsibilities to include some medical home rights. For example, the right to select a PCP, the right to change your PCP, the right to decide if you want a referral or not is actually one of the new ones. The patient is empowered to set self-management goals. The patient has a right to access a physician or a clinician 24/7. The patient, we've been promoting a patient portal. It is a medical home requirement that the patient is able to access the lab results 24/7. And even if they don't have access to the portal, they have access to a clinician. And for those who are on call, remember that if the patient wants the lab results, they have a right to get those lab results. Also, the patient has a right to request prescription refills 24/7. Okay? Patient has a right to request an appointment 24/7. Please do not say that when the patient calls, they can leave a message and we'll get back to them in the morning to make an appointment. No, you don't do that in the medical home. You can tell the patient we have a walk-in center, we have an urgent care center, you can come in for a same-day appointment with your clinician, and that is okay. But never be heard saying that we take a message at 2 a.m. and we call the patient back to make an appointment. That is not okay in a medical home where you want to prevent the patient from ending up in the hospital. All right, my time is up. He says I have a minute, but mine says I'm up. So I'm going to use this time. Okay. The last thing is just remember there's something called health literacy assessment. Okay? We ask the question, if you are given educational instructions from a physician or pharmacist, do you need help understanding it? Just file it somewhere. That will come up again for the care teams especially. We want to make sure you know we assess that. And we want you to remember the following things as I sign off. That please remember you did receive education on abuse and neglect and cultural diversity and hand hygiene and OSHA. Don't blank out on that when you get asked. Okay? Don't forget that we do not honor do not resuscitate orders. Please lock your PCs when you walk away from them. Surveyors will be looking to see that. That is a violation of patient's privacy. Make sure you remember the red dots and the orange dots. Make sure you remember some of the changes we've made as a result of becoming a behavioral health home. You need to know this. And maybe some of these things are so routine you don't realize that those are changes we made. We complete health literacy assessments, okay? And we assist selected patients to set self-management goals. Just remember that. This is really for the care team part of it. So again, thank you for your attention. I appreciate the high performers who are very engaged, who are owning the stuff. We're going to walk away believing that I am CHI, and when I get asked, I'm going to represent. And for those who perhaps tune me out, that's okay for today. Well, it's not okay, but we will send these slides out with lots more questions and answers, and please make sure you read them. Thank you so much for your attention, and I think Monica comes up next.
Good morning, CHI. I like that. I am CHI. Okay. So in keeping with what Dr. Mofa was just saying, hand hygiene patrol. CHI, for those of you that don't know, but I hope you do know, we do have hand hygiene patrol monitors. Hand hygiene is a national patient safety goal for Joint Commission, and I just want you to know that these monitors will be coming around, and they will be observing you wash your hands, or they may approach you and ask you to demonstrate how to wash your hands. So just a reminder, in doing this, please cooperate, and we want you to know that you need to scrub for how many seconds? 20 seconds. You want to front, back, under your nails, in between. Make sure you rinse your hands thoroughly, and when you dry your hands, what are you gonna do? Right, turn off, remember to turn the faucet off with the paper towel. Okay, not with your clean hands. Okay, CPR. We will be resuming CPR classes, so for those of you that have expired cards, some of you have already sent emails to us, but I ask each of you to check your CPR cards. If it is expired, please reach out to Patricia Philippe or my assistant, Carla Guadalupe. Send an email. We're in the process of scheduling classes, and we're hoping to get started as soon as this week. So please, when you get back to your sites, check your CPR cards and reach out to us, okay? Care coordination team. Our care coordinators, let me have them stand so you can all see them. I think we all know them. They're wearing, okay. So there's been some changes. As recent as Friday, the care coordination team will not be reporting back to me, nursing. We all know that our care coordinators are a valuable asset to the CHI team. And moving forward, some of our focus now will be on our deliverables moving forward will be driven by value-based healthcare model and ensuring quality care to our patients, that it continues to occur. And we will also be focusing a lot on PCMH model. So just wanted to update you all and know that the care coordination team is now back with nursing, but we expect to continue to deliver the same quality care that we've been doing all along, okay? And next, communication. Communication continues to be a challenge throughout the agency and the various departments, okay? So as managers, it is imperative that we communicate effectively with our teams. As managers, we're supposed to lead the way. So I just want to share a couple of steps that I think we need to include in our daily walk that can help us to achieve this goal. So one thing as managers we want to do is engage our staff. How well do we know our team members? How well do we know our team members? We also need to dedicate time to our staff. Be a good listener. Show compassion to our team members. Exchanging communication with a personal touch. Listening, being compassionate, and just knowing, ensuring our team members that not only are we their managers, but we are human, and that we appreciate the job that they do on a daily basis. Building a rapport. Team building is essential to any process, right? Team building contributes and boosts unit morale. Dr. Mofa touched on, we all come to work with issues and problems, and we know that some days it's difficult to get through the day. So as your managers and your leaders, it's up to us to, and up to you too, to share that with us as managers so that we know you're going through difficulty, and it's up to us to help you get through that. That we have EAP, we have other ways of helping you to cope. But our goal is to give you the tools that you need to do your job and to support you in getting it done. Finally, acknowledging good behavior, which is what we're going to do today. We know that you do a good job. We appreciate the work that you do. And there's another way of doing, acknowledging that, and that's through our CHI Action Hero Award. So for managers, if you have those team members that are going above and beyond or doing something outside of their job requirements, we ask that you nominate them for an Action Hero Award so that we can acknowledge them and show them that we really do care. Okay? Thank you.
Let's give another round of applause to Ms. Mizell. Good morning, CHI team. As my previous presenters, my presentation will be brief this morning. I want to talk to you a little bit about 3 grants that CHI was recently awarded. One of them is a Miami-Dade County Public Schools Mental Health Assistance Allocation Plan. As we know, last week, Thursday, was a 1-year anniversary of the Stoneman Douglas active shooter event. So there's some state funds that have been allocated to provide mental health services to the community. The second grant is our Jumpstart grant, which is a collaboration with University of Miami-Dade and 2 other community agencies. And the last one is our school-based health center capital program. So let's talk a little bit about the Miami-Dade Public Schools Mental Health Assistance Allocation Plan. This program will work in collaboration with the Miami-Dade Health Assistance Plan, and the overall goal will be to provide mental health services to the schools in the community. So CHI, along with 5 other organizations, will work to provide evidence-based mental health care and treatment for Miami-Dade public school students. So there's 8 services that we will focus on when we receive these referrals from the school board. The first service is mental health screenings. The second service is assessments, individual and group counseling, family counseling, substance abuse intervention, parent teaching school site consultation, and case management. Not necessarily targeted case management, but case management. One of the things that I really like about this grant is we will be able to work with the rest of the school board personnel to provide these services and provide services that historically have not been covered through Medicaid or any other funding source. The specific zip codes that we'll work with, a licensed clinician will be able to provide mental health services at the health suite. Services encompass assessment, student screenings, parent teaching consultations, case management, clinician consultation, and teams meetings as applicable. So if you see below, these are the services that we'll be working. CHI and the Gabby will be covering the south end of the county, and these are the service areas that we will provide those services in. The next grant I really want to talk a little bit about is our Jumpstart grant. And this program actually added 4 new staff to the CHI care team. The purpose of this grant is to reduce explosions of children 0 to 5 from home and child care center. Yes, 0 to 5, they do get expelled from daycares. You may not realize that, but they actually do. This program is known as the Jumpstart Early Childhood Consultation Program, which consists of 26 consultations consultants, who have been tasked to enroll 100 centers in the first year of the contract. The Jumpstart program will actually utilize the Georgetown Infant Early Childhood Mental Health Consultation evidence-based. The program is designed to strengthen early childhood educators, families' capacities to support the social, emotional well-being of young children birth 0 to 5 by partnering with important adults in the child's lives to help them manage difficult behaviors. So we're extremely excited to be part of this partnership with the University of Miami. We will be servicing the daycare centers in the South Miami-Dade geographical area. So that staff will actually have it's a staff of 4 and a supervisor. The last program I would like to talk about is our school-based health center capital program. And yes, we will be providing telehealth services in 4 specific schools. Just an interesting statistic, 90% of students in the Homestead, Florida receive food or reduced lunch, and the same percentage of high school students present with some sort of mental health and substance abuse or obesity-related issues. So we're extremely excited about this opportunity because this grant has allowed CHI to purchase some telehealth equipment, and we'll be able to remotely provide different services. Some of the services that we'll be able to provide via telehealth are nutrition consultations, emergency behavioral health screenings to include screening, brief intervention, and referrals, also known as SBIRT, behavioral health intakes, individual therapy, group therapy, drug screenings, psychiatric evaluations, and medication management. So we do not have to face the barrier where that parent cannot bring the child into the center to receive services. We'll be able to provide the service from one of our centers directly to students at the 4 targeted schools, which is Robert Rosa Morton Elementary, Cutler Bay Middle School, Homestead Senior High, and Dorothy M. Wallace Cope South Center. And in closing, I just want to remind everyone, teamwork divides the task and multiplies the success. Thank you, and we'll move forward with our next presentation, which is Ms. Tiffany Hellberg, our Vice President for Communication.
Good morning, everyone. Great to see you all here. So I'm going to go over customer service this morning, as I always do, because it's great to hear these things over and over again so that we can excel in this area. As you know, it's so critical to everything that we do and to our bottom line. If we want our patients to return, we have to treat them like royalty. Okay, so take a look at this picture. Who can tell me what is wrong with that picture? There's nobody sitting there yet. That's a good point. Anyone else? Yes, the monitors are obstructing the view of the patient. So if someone was sitting there, you couldn't see the patient. What else? I'll cut you guys a break because that's not the clearest picture. But if we were to zoom in, you would see that there's old literature there. It has the Give Kids a Smile Day flyer. That's old. It shouldn't be there. So why am I bringing all this up? Your work area is a reflection of this organization and of you. So it's critical that your work area is the best that it can possibly be. It needs to be clean. It's your house. I always walk around and say, this is your house. If you're at the front desk, this is your house and you're responsible for it. You need to make sure that it's tidy and reflects us all positively. No personal pictures should be there. Your computer should be off to the side so that you can look directly in the patient's eyes and they can trust you. If your computer is situated in the picture that we just saw in that manner, contact the IT department. They'll help you get it right so that you have eye contact with the patient. And get rid of old literature or outside literature. You need to be monitoring all the literature that's on your desk all day long. If it's outdated, throw it out. If some mechanic down the street leaves his flyers there, throw it out. It's your house. You need to maintain it. Okay, what happens when you have an upset patient? How do you communicate with an angry, upset patient? First and foremost, we listen with care and compassion. It's very hard sometimes to listen when somebody's very upset, but it's critical that you do this. You need to listen. Oftentimes, when a customer or patient is upset, they just want to be heard. They want to know that you're listening to their concerns. So sit there, be quiet, and listen. And then after they've told you everything, repeat it back to them. So I understand, if I'm getting this right, this is what happened, and this is why you're upset. Make sure you get it right, because that's important. They want to know that you listen carefully. Apologize. It's the hardest thing to do sometimes, especially if it had nothing to do with you. But you are a representative of the organization, so you must apologize on behalf of the organization. If you don't apologize, the patient doesn't feel like you really care. There must be an apology there. Take the patient seriously. Even if the patient's claims are way off base, you cannot seem like you are reflecting that back on them. You need to take that person seriously. You need to treat the patient with respect. We talked a lot about treating each other with respect. That's key, but we also need to treat our patients with respect. And you need to act immediately. What can you do to solve the problem right then and there? If you can't solve it right then and there, it's your responsibility to take ownership of the problem and find someone who can solve it right then and there. A supervisor, a site manager. Sandra Reyes. Sandra, wave your hand. She's outstanding at helping. There's always a lifeline, and when I do, let's say I can't solve a problem, but I'm going to bring the person to Sandra Reyes. I'm going to manage her up. I'm going to say, you know, Sandra Reyes is excellent at solving these issues. I'm sure she'll be able to help you resolve the problem so that it never happens again. You need to manage up your coworkers. So what sort of things can you say? From the customer service manual, we have this script. It's something just to give you a guide, but you can use your own words to make them more sincere. I'm sorry you're having this experience today. Our motto is patient care comes first. We want you to be happy. Let me assure you that I can help you. What can I do to resolve this situation? All these scripts are in the customer service manual. I also want to talk to you today about cross-selling. We've got all these amazing services and programs at CHI. You heard JP explain a few of them, and people just don't know about them. So it's our job to educate our patients and the community, and it's our job to ensure that patients have the full experience of comprehensive services. What are some of the techniques that will help you cross-sell our services? Know your customers before selling to them. Know your patient. What needs does your patient have? How about you talk to the person and ask them? Suggest relevant items. If I know my patient is overdue for a dental visit, let me suggest setting that up. Make your cross-selling offers sound natural. Don't memorize that script and just reiterate it like a robot. That's not what we want from you. We're giving it to you as a guide, but we want you to make it your own. Demonstrate value. We've got great value here, right? Comprehensive services. You can come here and do your dental services, your primary care, your pediatrics, your OBGYN. Where else can you do all these things? And reward loyalty. Thank them for being a CHI customer. Okay, so we have some example scripts here that you could use, but again, I want you to make it your own. Let's say you're a PCT and you're taking their blood pressure. At that moment, you can tell the patient, if you're prescribed any medications today, we can send your prescriptions to our CHI pharmacy for your convenience. We have free delivery to your home, or you can pick it up at any of our 4 pharmacies. We've got these pharmacies here, and they're awesome. Low cost. A lot of things are a lot cheaper than Walgreens or CVS. You guys can really, it's an easy upsell, frankly. What about if you work in the OBGYN department? We're trying to create a synergy as part of our strategic plan between OBGYN and pediatrics to help boost our pediatric practices. You could say something like, our pediatricians are amazing, They're great clinicians and truly compassionate. We offer free meet and greet consultations with our pediatricians so that you can decide if you'd like to have them for your child's doctor. Can I make an appointment for you today? How many of you knew that we offered free meet and greets with our pediatricians? Okay, a handful. Well, now you all know. So now I want to hear you all promoting that. What about all departments? Did you know that we offer multiple services here at CHI? Believe it or not, there are patients that I meet every day that still don't know that they're coming for primary care, and they don't know they could be there for behavioral health, for dental. It's our job to tell them. Did you know we offer multiple services here at CHI? We also have medical, dental, and vision. Can I make you an appointment for one of those other services today? If you can't make the appointment yourself, we have the internal referral line, which I will email out later today. Remember that your customer service skills impact us every day. A happy customer tells a friend, and unfortunately, an unhappy customer is going to tell the world. So it's key that we make our customers happy so that they tell people the positive things about CHI so they want to come back. Thank you.
Good morning, CHI. I'm really gonna try to talk slow. I have a sign here that says speak slowly, so I'm gonna do my best. So although my team and I do not serve the patients that you all serve, we serve you, and we do our best to serve you so that you can go out and offer the best patient care to our patient population. You are our most important asset at CHI. Anyone that tells you differently doesn't know what they're talking about. So, your engagement is the best compliment that you can give us. This year, for the first time, not just in the history of CHI, but of my 17-year HR career, which I love to talk about, we received a 65% response rate from you guys about what's working and what's not working at CHI. That is amazing. The responses that you provided are anonymous. I know a few of you didn't think that, and we proved you wrong. We had you come into IT and show you that we had no way to track where that information was coming from. The next steps are going to be your responsibility, though. We're actually going to change it up this year. It's not just gathering data and sticking it in a cabinet somewhere. We're actually going to involve you in action planning to make sure that we heard you and that we utilize all of your information and all of the data that you provided us to make those improvements. So I want to personally thank you for your candor and for your feedback, because to me and to our management team, you're the most important and valuable resource. The next two things are a little bit not as positive. I wanted to talk to you guys about two policies and procedures that we're constantly getting questions about or that we're having some employees have issues with. The first one is our proper call-out procedure. So all of you know that if you have to call out because life happens, it is your responsibility to reach a live person at CHI. All of you have a direct supervisor, and that supervisor usually reports to a director or a VP at CHI. Our expectation, according to our policies and procedures, is that all of you call your supervisor, and if that person's not there, that you continue to go up the chain of command to make sure you communicate. You must do this 30 minutes, up to 30 minutes before your shift, in order so that we can replace you and so that we can continue to serve our patient population. The next policy I wanted to review with you guys is outside employment, okay? I know that we talk about this at the inception. I talk about it during orientation, and you all receive a form that you have to sign indicating that you have a second job. I want to reiterate it for everybody here today. If you do have a second job and you haven't cleared it with us, it's very important that you do so immediately, okay? You may not know this, but every single one of you that's here was chosen to be here. We receive hundreds of applications a day. You can ask Santel and Gabby on my team, and you can see Robin that actually processes all of this for us. You guys were hand-chosen by our executive team and by our corporate staff leadership to be at CHI. What does that mean? That means that we expect you to make CHI your primary position. But we understand that sometimes it's not that simple. I myself have had to have internships in the past or a second job. So I completely understand that in some cases that's a necessity. Let's get it done right from the beginning. Come to HR, let's fill out the form, and let's make sure that we have everybody on board that we need to have in order to clear you for that second job. And that's it. I think I did it. Thank you very much for your time.
Let's give another round of applause for all the presenters this morning. All right, well, this is the moment that you all have been waiting for. We're actually going to start out this morning with the Teaching Health Center Award, so I'm going to ask our Chief Medical Officer to come up and present the Chief Resident Award, the Resident of the Year Award, and the Teacher of the Year Award.
Good morning, everybody. Before we start with the award for the Teaching Health Center, I would like to acknowledge all the Teaching Health Center staff that are with us today. And if they can stand up, I'm talking about the faculty, the residents that are here, the coordinators, and thank you very much. I have to tell you that we have an incredible team that we're working with at the Teaching Health Center. They're all great, and it's been a pleasure for the past now, we're starting our 5th year, and then if it wasn't for the teamwork that we have in the department, I don't think we would have achieved all that we have obtained today. And I have to thank Dr. Mofa also because he's part of the Teaching Health Center. Okay, so I'm going to start first with the Chief Resident of the Year. We have incredible Chief Resident for OBGYN, for family medicine, and for psychiatry. But we had to make a choice, and this year, the Chief Resident of the Year is Dr. Christine Dunlop. Okay, so I'm going to ask Dr. Mofa to accept it on her behalf. You know, residents have outside rotation, and sometimes it's difficult for them to meet some of our meetings. So, Dr. Mofa for Dr. Dunlop. Now, the Resident of the Year, do you know how many residents we have in the Teaching Health Center? If you don't, I'm going to tell you, you don't know. So we have 12 family medicine residents, we have 15 psychiatry residents, and we have 4 OB residents. They're all great. And if it wasn't for them, I mean, they're buying into the program and making it what it is today, we would not be here today. But we had to make a choice. And the Resident of the Year for the THC today is Dr. Kevin Almiri. He's a 3rd year psychiatry resident, and unfortunately, he's on PTO. He had to travel for the end. So we would like Dr. Mofa again, or to accept it on his behalf.
Thank you so much.
And then lastly is the faculty or the teacher of the year for the Teaching Health Center. Again, we have amazing faculty. We have tremendous team teaching our residents. But we made a choice this year, and the teacher of the year is new to our center. His name is Dr. Williams-Ervin. He's been on staff for the past, since July 2018. And unfortunately, again today, is on PTO. Dr. Mofa will accept the Thank you, everyone. And thank you, team.
Okay, I guess I'm going next. Provider of the Year Award. So like Dr. Philippe said, we have amazing clinicians, but we have to make a choice. And this second runner-up, I guess I'll call the name and we'll say a couple of things about the person, is Sharon Blair Pottinger. She here? Sharon? Sharon is a PA in a school-based clinic, has done incredible work in helping the entire team achieve some incredible goals. We're so, so proud of her. She's been very loyal to CHI, and so congratulations, Sharon. All right, the second runner-up. Oh, I'm sorry, the first runner-up. Same difference. Okay. The first runner-up is Dr. Amofa. I'm sorry, I'm just kidding. Dr. Robert Johnson. Where's Dr. Johnson? While he comes up, we know Dr. Johnson has been in CHI over 30 years. He's just provided outstanding work. He's been acknowledged multiple times by all of you for his compassion and his care and his dedication. Dr. Johnson, in spite of giving up the role of the Director of Oral Health Services, continues to provide such valuable input in the committees that he continues to be a part of, the wisdom he provides and the guidance. And so Dr. Johnson, congratulations for being a first runner-up Provider of the Year. And the Provider of the Year award. Is there a drum roll somewhere? Christopher Edward.
right, now moving on to our actual winner for the Behavioral Health Employee of the Year Award. Needed some more time to speak on this young lady as well. This employee is always there to assist on the front end with providing appointments, ensuring the area is not crowded. She truly loves to engage in conversation with clients, making them feel welcome and at ease, and also provided a significant amount of dedication to ensure this day went by seamlessly. Can I get a round of applause for Ms. Contrell Young? One more applause for the Employee of the Year for the Behavioral Health Department. Okay. All right, so now I'm going to move on to satellite services. Do we have any satellite services staff here? We're not excited. All right, so I'm going to move on to the second runner-up. This employee has provided many caring years to our patients. She completes and takes pride in her work duties. She contributes to all of the pillars of service: people, quality, growth, and finance. She is always managing up our centers and our providers, and she is an asset to our mission. Ms. Kelly Darris. Kelly, are you here? All right, moving up to our first runner-up for satellite services. This gentleman is always willing to cover different shifts or sites as needed. He always ensures that our staff and patients are safe. Can I get a round of applause from Mr. Alfred Parker? All right, and now it's time for the winner. This provider is a definition of great patient care and great teamwork. He comes in early to start on the long line of walk-ins and stays late to help the other providers work on his task. He is a true representation of patient care comes first. Mr. Gregory Fignoli. Okay, we're going to ask Dr. Mofer to come up as Gregory is on PTO today. Okay. Okay. Let's give it up for our satellite services. Okay. All right, we're going to move along to the Doris Eisen Awards. Our second runner-up, this employee is a true team player. She always has a pleasant, quiet demeanor and helps her department team members with whatever tasks are required. Can I get a round of applause for Ms. Kamani Ramdad? Jeremy, you want to come up? Jeremy, you want to come up? All righty. First runner-up, this lady is always courteous, respectful, caring, and helpful to employees, vendors, and patients despite the high stress level of the department. She takes the time to assess and communicates on matters that affect workflow and is accountable in all aspects of her job. She even delivers emergency requests herself when others are not available and is truly an asset to CHI. Can I get a round of applause for Ms. Robin Davis? Jeremy, once again. All right. Are you guys ready for the winner for the Doris Eisen Employee of the Year? Are you guys ready? All right. This provider goes above and beyond every single day. He is deeply committed to CHI's patients, and it is a pleasure to work with. He is always moving at warp speed, but still providing quality, accurate care to his patients. I would like to announce Mr. Jose Pennis as a winner of the Doris Eisen Employee of the Year Award. Dr. Nunez is going to come up and Mr. Pennis. All right, now it's time for the overall Employee of the Year. And the winner of the Employee of the Year award is Mr. Jose Pennis. Is he going to have him come up again? Jose is not here this morning as he's actually in our walk-in center providing service to our patients, but I would like to have another round of applause. All right, Control. All right, so Ms. Control Young is actually going to present the next set of awards.
So the next set of awards are Special Meritorious Awards. The next set of awards will be our Special Meritorious Awards. So when you guys come up, we are going to line you up at the bottom so that we can all take one large group photo, okay? So the first individual is Gina Allenby. Gina Allenby. Evelyn Cifuentes. JP, do it down there. Kelvin Burns. Masarian Brumeri. Merceron. Sorry. Kelvin's not here. Damie Cadis. Jose Valle Sereno. I think that's her. I think that's Damie right there. Lillian Rodriguez. Carla Correa. Carla Correa. Kelvin Cooper. Denise Salvitra. Denise Savitra. Shania? Calvin Cooper's not here either. Calvin Cooper's not here. Hugo Velera. Saya Millón Aros. María Montoto. Mr. Aaron Moore. Ms. Flor Ochoa. Flor Ochoa. Beverly Pitaluga. I always butcher her name, Guyleen. Yeah. Galine Presidou. Raj from maintenance. Justin Vogt. Carlene Weller. Dr. Rosalind Johnson. Mr. Fred Thomas. Albertina Matarangas. No? Demetria McCuller. Maya Santiago. Amelda Chavez. Miss Robin Lipscomb. Jovita Johnson. Vicente Lau. Hervé Supplice. Devin Smith. Carla Guadalupe. My bad. Marie Desanor. Leah Reed. I guess that's Marie. Daniel Rivera. Tamika Warren. Rolando Monteagudo Gonzalez. Edre Santos Rivera. Robert Chester III. Natasha Ford. Jennifer Mendoza. Josue Tercero. That's Jennifer and Deborah Jose. Dana Roberts. Alexandra Fernanda McCrae. I guess Alex is on PTO. Ingrid Goodluck. Oh, she's here. Ellen Smith. Rocio Vivas. Calvin King. Jesse Williams. MacArthur Joseph. Guillermo. You know I can't pronounce your last name, Guillermo. Let's go. Katina Smith. Some of y'all can stand next to Dr. Johnson and on the other side. Some of them can stand next to Dr. Johnson. Calvin. Stand next to Dr. Johnson. Tell him stand next to Dr. Johnson. Guillermo, stand next to Dr. Johnson. Right there in the front. Special. Osnedi Otano. Jercolito Iglesias. Tony Tusi. you want me to move this?
First shall be last, and last shall be first. I have the privilege of recognizing individuals for the Chief Executive Officer's Award. And this year, this has been a difficult job to narrow this down to just a few people, because so many people have done so much during this year that was special to me. But the first recipient of the Chief Executive Officer's Award this year goes to a man who has given his expertise, his keen sense of urgency, and his acumen in finance to the benefit of CHI as we had to right the ship this year. And so I would give the first award to Mr. Rick Friedfeld. The next award will go to a gentleman whom I've come to respect a great deal. And he's moved into a position and has brought great recognition to CHI through his contacts externally to the organization and his leadership internal to the organization. He has brought new contracts and grants to the organization that places CHI in unique position. And when I talk to outside agencies about this young man, they have nothing but praise for what he has done and how he represents CHI and in the community. So the next award goes to John Pierre. The next award goes to a lady who has represented an activity within CHI that I greatly appreciate. And she has led our Teaching Health Center as a program director, and of course, has led the family medicine team to outstanding achievements. Under her leadership, we have had a 100% pass rate of our family medicine residents. Thank you so much. Dr. Philippe. The next gentleman is a young man that I have come to respect. He's a smart young man. He brings expertise that we dearly need in CHI. And he is our VP for Finance, Mr. Jeremy Redzowicz. The next award goes to a lady who has provided so much in terms of her expertise and has provided essential training to our staff. And she is with Health Choice Network, Zaida Naranjo Holland. And the official awards are completed, but I wanted to do something very special for a group of people who work so hard, 365 days a year, providing service to our staff and to our patients. And I want to recognize the special awards from me. Special awards from me. And I would like Gerald, food service staff, come forward, please. Sorry about it. I shouldn't come down and shouldn't make you walk.
You got told him this morning you gonna see him again.
Also want to recognize Ronald McFarland.
Thanks for all you do, man. Appreciate you. Okay?
Mr. Duarte Roland Jiggs.
Thank you, my man.
Ms. Maribel Flores. Thank you so much. All right. And last and certainly not least, let's hear from Gabriella Martin. I want to thank all of you for being here this morning. You all deserve awards, but we have selected just a few today. But in closing this session, I would like to say, especially for those of you who wear uniforms, that you will be receiving your uniform allowances. We will present that request to the Board Finance Committee on this coming Tuesday, and the following Tuesday, the Board is expected to approve your uniform allowances, and it will be presented shortly thereafter by check to you. Thank you. And that concludes our program for today. Enjoy President's Day. Don't spend too much money. All right. Thank you.